Hey, thanks, Izzy. Hey, everybody. We're getting inquiries, so just wanted to give a little report. Last week I wasn't feeling well, wasn't exactly sure, out and about on the campaign trail, and thought I had maybe some allergies, and took on three different occasions, got three negative tests, two of them the rapids, one was the 48-hour more comprehensive. Um, and continued to not feel well. And then on Sunday, I lost my taste and knew that was, not anything normal. So I went for another test on Monday, and that's when I've got the report that I was testing positive. Want to just give a huge shout out to Mercy Health, and a huge shout out to all of the healthcare workers across the country, having been with them up close, over the past week on multiple occasions. They are burnout, and it's something we all need to be responsible for, getting our vaccinations, and making sure we do our part to try to relieve the burden. They're going morning, noon, and night consistently on the front lines. And so I want to make sure that, one, we thank them, but two, we try to do our part to reduce the loads that are going into the hospitals, and even home health and nursing homes. It's those people on the front line that are really taking it on the chin. So I wanted to give a shout out to them, and happy to take any questions.
And again, if you want to use the raise hand function, okay. I'll go first to Haley. I'm unmuting you now, or you should be able to unmute yourself now.
Hey, Congressman.
Hi.
Any ideas at this point where you might have been exposed?
No idea. We've let everybody know, and have been at a number of events where people have been testing positive. So not quite sure, but at this point, it's like I said, we did three tests, two rapid, one 48-hour, and not exactly sure where it came from, but was testing positive testing negative for a while, until lost my taste on Sunday. So no, haven't narrowed it down.
And we'll go next to Bridget Bowman.
Thanks, Congressman Ryan. Sorry, I'm in the press gallery at the Capitol, so it might be a little loud. But I was wondering, you just mentioned there are events where folks tested positive. Do you mean at your campaign events? You then heard of people testing positive?
Yeah, not till after. We've been doing very various events over the past 10. This is going on 10 days now, so if not more. So yeah.
And to follow up on that, I was wondering if this breakthrough case has you rethinking doing in-person events in the campaign for the foreseeable future.
Yeah, what it has me really, focused on. Yeah, I mean, I think we all got to be careful on how we're moving forward. But the idea that I'm fairly young, pretty healthy, and still have this to deal with, just shows how important the vaccination is. So we want to continue to try to press and encourage people to get vaccinated, and wear masks, and do everything that's responsible, I think, moving forward. You can't stop living, you can't stop life, but I think, taking these precautions, and again, having, interfaced with the healthcare system in the past week, it's critically important that we try to reduce the load. Most people that are vaccinated, are like me. They're at home, they're quarantined, they're doing okay, they're riding it out. But what's really hurting and pressing the healthcare system at this point are the unvaccinated going in there and wreaking havoc on the healthcare system. So that's where I think the focus needs to be.
And just to clarify, oh, sorry. Can I?
Oh, no, sorry. Yeah, you can go ahead.
I just want to clarify. So do you plan to continue in-person events as soon as you can?
I would assume, we haven't had that conversation yet because this just happened, and we'll be quarantined, I think, until almost the end of the month, till probably October 1st or something like that. So we'll be having that conversation, and I think having that conversation with a lot of others because it's starting to pick up. I mean, here in Ohio, we're seeing schools start to implement masks in the schools. We're seeing, a number of football games that have been canceled both last weekend and now this weekend, and other, athletic events, the conversations around some virtual schooling again. So I think our campaign, like everybody else, will be evaluating this in the coming days to see, exactly what the world looks like again.
And now I'll go to Sabrina Eaton. Should be able to unmute now.
Hey, Congressman, how are you feeling? What are your symptoms like? And is your family quarantining as well?
Yeah, we're all kind of quarantining here. My wife has had a negative test, and our daughter's had a negative test, and Brady did test positive. He's here. And so we're just, kind of being careful here in the house. And I'm tired. It's and it's what I tell everybody. Look, I'm young, vaccinated, and pretty healthy, and this thing kicks your butt. And I can only imagine not getting the vaccination. That's why we're seeing what we're seeing in the hospitals and in the medical facilities. So even though I'm fairly healthy, I'm still tired. I've slept probably 12 to 14 hours a day. A night in the last few nights. So, it does beat you up. The fatigue piece that you hear about is real.
And how's Brady doing?
He's fine. He's fine. He has, no real symptoms. He had a little headache the other day, but he's fine.
How old is he these days?
He's 7, he's a little over 7.
Okay. Well, I hope you all feel better soon.
Thanks, Sabrina.
And I'll go now to WKBN. You should be able to unmute yourself.
Hi, it's Nadine Brimley. Just
Hey,
wanted
Nadine.
to ask you, when did you get your last vaccine, and when were you considered fully vaccinated? And which vaccine did you receive?
I got the Pfizer. I'll have to check with you. I don't remember when I got it. I'll have Izzy get that to you. It was in the early spring sometime, I think.
So within the last 4 months or so?
Honestly, Nadine, I can't remember. I mean, we got the card, obviously. I'll get you the exact date, but yeah,
Okay.
It was Pfizer, so it was 2. I don't know if Izzy, if you remember offhand, we probably should have ran that down, but yeah, we'll get that to you. But it wasn't early, but it was springtime, springtime for sure.
Okay.
And I'll go now to Catherine Tully McManus. You should be able to unmute.
Hi, Congressman. I'm at the Capitol. I know you haven't been at the Capitol for a while because of recess, but I'm checking in on how you think the Capitol community is equipped to handle breakthrough cases. We are seeing this more with staff and lawmakers in Washington right now. And many things have gone back to in-person hearings, normal caucus meetings, etc. I'm interested in if you think that path will continue or if they should make some rollbacks.
Well, my sense is that it will continue. Again, every member is vaccinated. A lot of the staff is vaccinated. I'm assuming most of it can kind of stay on the pace that we have now, where there's some in person, and then there's also these committee weeks that are being handled remotely, which I think saves the taxpayers, a lot of money because of the travel savings that we have, but also, an opportunity to do it remotely and get the job done. So again, we're gonna have to see where everybody is here in the next week. I know we're back next week and then off a week, and in those few weeks, we're gonna have to decide and see where the world is. Again, people are coming from hot spots. It seems like and back to the floor, but everybody's vaccinated. They may have to tweak the routine on the floor, not to have everybody standing around for extended periods of time on the House floor again. So that may need to be adjusted, I would think. But that will be determined by the lay of the land in the coming weeks. And I know we put some additional resources in the previous bills, and we've got the appropriations coming up, hopefully the end of the year. And, we can always make adjustments there if we have an influx of cases that need to be handled and cleaning and all the rest. But I think we've put a lot of money behind this already, so it shouldn't be an appropriations issue. It'll be an issue based on the local public health issues, that will be dealt with by the Capitol.
Thanks. Can I just, I haven't seen your, I haven't looked up your proxy letter. Who is voting on your behalf while you're out right now?
The distinguished gentleman from Flint, Michigan, Dan Kildee.
Okay.
They don't really have a football team in Michigan, but they do have a good congressman.
Thank you, Congressman.
Mm-hmm.
And just to follow up, Nadine, he got his second dose on March 3rd. And does anybody else have questions? If not, feel free to email me, text me, call me. I gave my number at the top, but it's 215-779-3910. Or you can email me at Izzy, that's IZZI, @timforoh.com. As always, don't hesitate to reach out. And thanks so much all for logging on this afternoon.
All right. Thank you.